Assalamu alaikum, and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board-certified family physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can find us on Roku TV, Samsung Galaxy 19, Apple TV, and Fire TV. And you can also watch us on our YouTube page at youtube.com/Muslim Network TV and on our website, muslimnetwork.tv. Today, as usual, we have another exciting episode, and we will be talking about the world of acupuncture. It's considered alternative medicine here in the West, and so we have a lot of questions about it today. And joining us in that discussion is Alexandra Khouri. Alexandra is a national board-certified and licensed acupuncturist, Chinese herbalist, and hypnotherapist for more than 10 years. Alexandra graduated from Tai Sophia 5-Element Acupuncture School and also spent time interning in Anhui University of Traditional Chinese Medicine in Hefei, China, that is, in 2011. She specializes in natural fertility or assistance with IVF treatments, skin disorders, sports injuries, smoking cessation, anxiety, stress reduction, cancer care, and weight loss. Alexandra is now working towards creating a space for Muslim and women-owned businesses, with her company, Aalia, Strong Women, an Aalia podcast, and also creating content to empower women to succeed as an entrepreneur. Welcome to our show, Alex.
Thank you so much for having me. I'm really excited to be here.
We're really excited to have you. Before I invited you, I was just clueless about the world of acupuncture. Of course, I am trained in traditional Western medicine, and acupuncture maybe gets a paragraph in our medical curriculum, of course. And so we just don't traditionally learn a lot about it. So I'm really excited to have you on here so we can talk about some of the benefits and some of the things to expect with acupuncture treatment. So I guess to get us started, tell us a little bit about what acupuncture is, what a little bit of the history, what it was intended for, etc.
Great. So acupuncture is actually a form of Chinese medicine in which we insert thin needles that are inserted in the body. And it's a practice that has been done over 2,500 years. So what happens is, in theory, it's like we put the needles in specific points and pathways that we call meridians, and that corresponds to certain organs in the body. And with each system or symptoms that people are having, we put certain needles in certain places. So we create like tiny injuries in the site, and then the immune system responds and signals the body that there's something going on in that area. And then it stimulates the immune system and promotes circulation in the area, and then creates either healing or some kind of reaction to the needle. So acupuncture is really a whole system kind of medicine.
Okay, that's really interesting. First of all, I can't believe how old it is. So it's maybe one of the first forms of medicine, would you say?
Yes, it is. And what happened in the past is that they used tools like rocks or, bigger, form of needles, and they would put it in on the pressure points and kind of treat that way. It's very fascinating.
Interesting. It is fascinating. And so you mentioned different meridians. I've also read about the term qi. And so is that the same thing? Can you tell me a little bit about where the word qi fits into this?
Yeah. So, most acupuncturists, we believe that the human body is filled with an invisible life-giving force, and that is called qi. And, this qi, when it's flowing well, when you're doing well in your life, you're eating healthy, you have your mental and physical health is great, then the qi is balanced. But when the qi is flowing incorrectly, or there's some kind of blocked or deficiency, that's what we call an illness. That's what results in illness. So what we do as acupuncturists is we treat the qi and to create balance in life so that your ailments also are balanced and are better.
Interesting. So would you say that with acupuncture that it's, because you mentioned that the imbalance is what results in illness. And so usually, do you have patients coming to you when they're ill, or can patients come to you before they're ill to prevent that imbalance from happening as well?
Yeah, so both both patients, like both kind of things happen within this treatment. So either somebody comes in with an ailment, they're suffering from something chronic that hasn't resolved with medicine, or they are really also mentally unhappy or whatever that is, then they would get treatment and get better. But some people actually have had patients that come in seasonally to kind of get like a boost for their immune system, just that because they feel much better after getting a treatment. So they would come in like every 2 or 3 months and just kind of feel better that way. So yeah, you can come in with an ailment, or you just come in because you want kind of like a overall balance.
Interesting. So you use the word like feeling energized and a boost. So
Yeah.
people, even outside of having illness, can find benefit because they feel more energized. Is that what you mean?
I mean, it's so fascinating again, because whenever somebody gets a treatment, the results is so different for everybody. Nobody has the same results.
And
Yes,
also
there are.
from episode to episode, it's inconsistent within the same person as well.
It is because
Okay.
everybody is, different every day. Every day somebody might feel worse or better, or their energy is just different. So even with us, when we look at your tongue, which is one of the diagnoses, it changes the next day,
Mm.
or even within 2 days. It's so even after a treatment, when we do diagnosis, which is also we diagnose through your pulses, it changes. So we have to know what's happening at that moment and treat that moment.
Very cool. Very
Yeah.
cool. Now, a question for probably our audience who don't or are scared of needles
Oh, okay.
would
Yeah.
be, does it always involve needles? Are there other techniques that you also use or can use instead, or if needles must be used, how do you calm your patients down and explain to them the need for needles?
First of all, the needles are so thin, they're as thin as your hair, like a strand
Okay.
of hair. So when I do the acupuncture points, usually you feel like a prick sensation. Then after that, you don't really feel the needles. So a lot of the times when somebody's scared and they come in, I really try to make rapport and, get rapport with them, talk to them about what's the issue, what are their fears. And then I would start with the back treatment first. So they don't really see the needles. And I would say, hey,
Mm,
did you feel
smart.
that? You
Yeah.
have like 10 needles on you, they don't feel it. But if somebody is really scared, or if I'm actually treating children, I start off with acupressure. There's a lot of different modalities. You can do acupressure on the points. You can use an electrostem, which is electro currents that go through that point. You can do gua sha, which is like also kind of a pressure. There's also cupping. I'm not sure if people know what that is. That's like cups that suction the area and also create a blood movement in that area. So there's so many different ways that we can treat if a person is scared of needles, and then hopefully they can get to the needles, and then get a better treatment that way.
Awesome. Well, that's good to know that there are desensitizing techniques that you use to help patients, because that's something I hear a lot whenever the idea of acupuncture comes up, or needles in general. People are just nervous. And it's so funny because it's the people that have the most tattoos that I find are the most afraid of needles.
Oh, that's so weird. I didn't know that.
Yeah, I mean, in the medicine world, at least, those are the ones that are, they don't want to get the shots because they're afraid of needles. They hate
Oh,
having to get blood work. And then I'll look at their arm and I'll be like, you have tattoos
what a
all
needle.
that don't involve
Pricking
needles.
you.
Yeah, we're much worse because some of their tattoos take 10 hours, etc. I'm
Yeah.
just like, this is like a quick in and out. So
Yeah.
that's great that there are other options for people who are nervous about needles.
Mhm.
As far as other things related to needles, this may seem very basic, but as far as like keeping them sterilized, are you guys reusing needles, or do you throw them out? They're disposable. Okay.
Yeah, so in the United States, we have a clean needle technique certification that we have to pass, that we have to make sure that all our needles are disposable needles and we use them one time. Even if we put a needle on a person and then, it either pops out or something happens, we do not insert the same needle. We just dispose it in a needle disposal container, and we ensure that everything is clean and there is no cause of infection. In overseas, in China, however, they do reuse needles, which is something that I actually spoke with one of the doctors there, and I had concern with, because definitely needles can never really be fully sterilized, which I think. So I think definitely disposable needles are the way to go. If you do go see an acupuncturist who uses reusable needles, it's really not allowed in the United States.
That's good to know. That's really good for our audience to know what to
Yeah.
expect and what are the standards of care and practice here in America. And you're right. I definitely would have a lot of hesitation about going to see someone if I knew they were reusing, regardless of sterilization. I mean,
Yeah.
it would have to, especially with the number of needles you're using and the different sensitive points that you're inserting. I agree. I think I would be very hesitant. You've mentioned about your certification and your training. So
Mhm.
I would love to talk about that a little bit, because you actually traveled to China and were
Yeah.
able to see that in person. Can you share with us a little bit about your specific training and a little bit about the training that goes into getting a license to be an acupuncturist?
Yeah, so to be an acupuncturist, you have to do an associate's degree at least
Okay.
before getting accepted into a university for acupuncture. So you have to have 2 years of any kind of associate's degree, and you also have to take courses that are required. So there's a lot of pre-med courses that you need to take to get into certain universities. And then after that, it may take 3 to 4 years to graduate. And you also have to have at least 950 hours of clinical hours. So you need to in order to become an acupuncturist. And the biggest thing is that you do have to take a national board certification and pass those exams. There's about 3 or 4 exams that you have to pass before getting your license.
Got it. So does
So,
everyone have to travel to China, or was that just a preference
oh,
on your part?
no, you don't have to go to China
Okay.
to graduate, but I did. I was fortunate to be able to go.
Very neat. And do you find that it's very similar to how acupuncturists, yeah, no?
Yeah, no. It's really different
Oh,
because
really?
let me tell you, in China, you are actually a kind of a doctor as well, because you
Okay.
have to take Western medicine in order to be an acupuncturist. So you do learn all the Western medicine to be an acupuncturist, and then you specialize in acupuncture. So in China, it's very fascinating because I love this word fascinating, because in the hospital you have the Western doctor and you have the Chinese medicine doctor together working on a treatment plan for the patient. So they would take either Chinese herbs and Western medicine, work with acupuncture daily, and do other things with the Western. It's really a
How
really
neat.
nice
Yeah.
synergy.
That's
Yeah, it's really
really,
great.
that's really, really neat.
It's
And
really neat.
so
Yeah,
it sounds like in general, society there is more accepting as well. I think
very
that
accepting.
I mean, it's been around for thousands of years, especially originating in China, that I'm sure it's a way of life there, as
It is.
opposed to here, where a lot of people are hesitant because they don't really know how much it can benefit them, or if they've been hesitant to try it.
Yeah.
When someone is looking for an acupuncturist and wanting to make sure that they're going to somebody credible, of course, somebody that's reliable, what are some things that our audience can look at, or a database or registry maybe that they can look to find somebody?
Yeah, so if you go to nccaom.org, this is the National Commission for Acupuncturists. They have
So I'm sorry.
nccaom.org,
Okay.
and then they have a practitioner list. So you can find an actual licensed acupuncturist in the website. So then you know that they're licensed. And then I think there's another acupuncturist website. I'm sorry, I don't have the name for that.
Oh,
Yeah, so you can definitely see if they have also what I have in front of my name, which is el.ac, then they're a licensed acupuncturist.
okay.
So that's what you need to look for. You want to make sure they're licensed. And there's another one, it's DOAM, D.OAM. That's a doctor of Oriental medicine. So,
Got it.
yeah.
Okay. Okay. So definitely wanting to make sure that they have some kind of licensure, either by looking them up on the website that you mentioned, or
Mhm.
if they have their own page, making sure that they have some kind of credential, either the L, as you mentioned, which stands for license, or the Doctor of Oriental Medicine. Okay.
Mhm.
That's really important because we definitely don't want, you want to go somewhere where they can also manage any kind of side effects or adverse reactions. Correct, I would imagine. And I do want to talk a little bit more about that. But before we do, we are going to take a quick break. You are watching What's Up, Doc on Muslim Network TV. We'll be back in a few minutes.
Assalamu alaikum. My name is Adam. You remember me? I appeared in so many episodes that Sound Vision has put on the market. No matter what. Hey, what's happening? Hey, oh, sorry. Lockdown is what it is. Well, continuing here. In this lockdown, Sound Vision never stops thinking about you, the viewer. We'll have to get back into production again, online and inline. Everybody in their own space, even me. Although I'm stuck with Lanisa.
Salam! Salam! Salam!
I know, you were shocked too. Well, let me continue. This is what I was going to say. Salam! 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 Cut! 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 Finally, I get my own screen time again. Thank God. And so we invested in new equipment to bring you even better production with new songs and new singers and animations. Well, here are a few clips. And Sound Vision has brought all this into your home, making Islamic values and teachings easy. And if you know me, Adam, a multi-talented actor, well, sometimes I'm an actor and the reporter and the... Oh, that's enough. Let's move on to the next section. Well, you can watch these new episodes on our new app at www.adamsworldapp.com. We have previews happening every day on Muslim Network TV. Sound Vision has been serving generations, moving and changing with the times. We are all faithfully connected. That is a huge blessing. Your donation helps keep these programs available now and into the future. we take this job of helping tomorrow's Muslims today seriously, and you should too. Today, we need your help. Children absorb and learn from everything they encounter. Make that wholesome, positive, grounded in our faith. Together, we can accomplish our goal of raising better Muslims, better neighbors, and better citizens. Please donate generously.
It's an investment in our future.
To finish, let me tell you, there are new scripts of my new mission. And it is something that I enjoy talking about. My new mission is space. Houston,
We do not have a problem. Salam. See you soon. Me too.
Hi, and welcome back to What's Up, Doc. Before the break, we were talking with Alexandra Khouri. She is a licensed acupuncturist, and we were learning about the benefits of acupuncture as well as the history of acupuncture. And so I definitely think that so far, everything that you've shared with us is super exciting, Alex. And I feel like it, just like you mentioned in China, that it can complement Western medicine. I definitely see a place for it. Let's talk a little bit about what are the conditions that can be treated with acupuncture, because a lot of people are probably unfamiliar with the benefits besides being used as, you know, the way that you would use a massage or something like that versus a true treatment. So let's talk about some conditions that you have either personally treated or that in general acupuncture is good for.
Okay, so yes, the first big treatment that most acupuncturists usually see is chronic pain or pain management for people who have been on a lot of pain medications for a long time, it's not working, or if they had any injuries. So a lot of people come in with that, and we do help alleviate the pain, help the muscle flow, you know, work the blood into that area, and with cupping. So that is one of the big ones. And another, you know, there's so many things. I think what people don't realize is that acupuncture can treat a lot of things, almost everything.
Yeah, I love that. I hate to interrupt you, but I really
Yeah.
love that you mentioned pain medicine, because we are in this country suffering from what we're calling an epidemic here, right?
Yeah.
Of opioid abuse.
Okay. Yes,
And we have a lot of people that are addicted to opioids as a result of prescription medication for pain.
Yeah.
At one point, you know, we have 4 vital signs, you know, your blood pressure, your heart rate, your respiratory rate, and your temperature. And at one point in the world of medicine, they were naming pain as the 5th vital sign. And so they were also measuring along with when you go into your doctor, they were measuring your pain scale. And so they were saying that we were not treating patients for their pain enough, that we were under-treating. And now it's funny because the pendulum has swung the other way, where I believe we're over-treating. We're really giving people narcotics, really dig deep to understand where the pain is coming from and addressing the kind of pain that people have properly. I see this a lot, especially in primary care, where patients go to the ER, they're leaving with narcotics for things unrelated to pain. And so I love that for people who truly do have pain as an issue, that acupuncture is an alternative method of treatment. I think that's great, and it's something that I'll consider for my patients.
Yes, you know, a lot of times I would work with the doctor and we try to reduce the pain medication together. So what would happen is that they would come in, and as they're getting treated and, you know, coming in maybe twice a week, they would notice that they don't need as many pain meds to feel better. So then, of course, you don't want to reduce it without working with a doctor, because there's so many side effects that can happen. So I would say, you know, give me your doctor's information if it's, you know, possible to share information. And then we would work to reduce the pain meds so that they can, you know, stop taking pain medications. Because it is an addiction. And I actually, in my schooling, we had to go to a facility of drug addicts that had to be court ordered to get acupuncture because they were addicted to pain meds. So we'd treat certain points in the ear, and it would help them either get off their drug addiction and feel much better. It was really amazing how the results, people really felt so good, and they were court ordered by the
to seek treatment for
alternate treatment, because they're not allowed to take anymore. They were overusing the pain medications.
What a different world.
Yeah, it is. I know. I wish doctors knew more about alternative medicine, because I think incorporating it in, especially chronic issues. I'm not saying if there's emergency situations, because there's no comparison with Western medicine and alternative medicine for that. But for chronic issues, there's such a different world.
Well, that's part of the point of this show, is to help awareness of topics that either are commonly talked about or topics that are not only talked about, but we think are important. So thank you again for being here to share this.
Thank you so much for having me.
Absolutely. So in addition to pain medicine, because that's really important, or pain treatment rather, chronic pain, what about things like metabolic diseases like diabetes or high cholesterol, hypertension? Of course, like you said, there is a place for Western medicine, and sometimes we obviously always recommend patients do what we call therapeutic lifestyle changes.
Yeah.
So smoking, encourage them to stop smoking, exercise, things like that. But with respect to acupuncture, can that help with these kind of chronic diseases as well?
Yes. So it's funny you said that, because yes, we do treat a lot of people who have hypertension, or I had treated a lot of pregnant women who had hypertension in their last trimester, and it would help them be balanced, because that's the safety of the fetus and the mom. So they would come in weekly, and they would feel much better, and even for blood pressure, because their blood pressure would go down. But even for diabetes, like, we also help kind of balance the body with Chinese herbs. But again, this is you have to find a licensed herbalist, because herbs are like medicine. So you want to make sure that if somebody's taking medicine, you're not having any interaction with the Western medicine and the Chinese medicine, because they can have interaction. So yeah, we can treat so many things. I've also treated people who have menstrual disorders, and they are not, they have PCOS, or they have cysts, or any kind of that thing. And I've helped reduce cysts, and we do treat as a whole body. We never say that we're just, specifically treating cysts, because we think that there's so many other things going on, whether it's like their stress level, whether there's, past, things that they've taken that affected their body. So there's a lot of things that we try to clear out of the body to help, specific ailments. And
so if I'm understanding what you're saying, and going back to what you said at the beginning with the balance, what it sounds like to me is that whatever your ailments you may be coming in with is a result of this imbalance that you spoke about in the beginning. And really, acupuncture is more about restoring that balance than it is treating a specific thing, because the idea is treating this imbalance treats the thing,
treats the ailment. Yeah,
absolutely.
It's funny because some people's ailments are really an emotional thing. Okay. So some people have had pain and chronic pain. It's because of their emotions. I'm not sure if like fibromyalgia is kind of in that category where we really don't understand fibromyalgia, and we've associated with a lot of like emotional stress. But if they treat like emotional, like hardship that they've held onto, something, really hard they dealt with, it's in their body. And we do a lot of clearing. We call it clearing treatments to help remove the first layer like an onion. So then you'd go deeper and deeper into what is the root issue. And you find that after you've treated a patient for a while, you find the root of the reasons why they had all these ailments. So
interesting. So how many on average, it sounds like it's definitely not a one and done thing. How many on average sessions do you, and of course, as you mentioned, it's different from one person to the other, but on average, how many would you say a person would need to really give acupuncture a real shot?
I would say at least 6 sessions.
Okay.
And some people give up maybe in one session. They feel like, I didn't really get much from it, but they don't really know that there's some small things that have gotten better, like their bowel movements got better. And they don't associate that with acupuncture. So it's like, they're like, oh, it didn't really work. But if I ask them questions, I'm like, so how did you finally use the bathroom? So there's like these little questions that come up, like they're like, oh yes, I did. I thought, it maybe there's some correlation with their diet or whatever it is, but it's like right after they had the acupuncture treatment. So these kind of things. So you need to give at least 6 sessions a shot. And a lot of acupuncturists try to have you come in twice a week. In China, people come in every other day, but it's part of the governmental payment. So it's not like, it's not expensive for them. But here we try at least twice a week, or if not at least once a week for the first month,
Yeah.
And then I really, my goal whenever I see a patient is like, I don't want to see you anymore. So that's why I always tell them, I don't want to see you, but it's really because I want them to feel better. So
yes. And them not coming back means that things are better for them, and that's the whole goal of therapy and treatment, of course.
Right. Yeah.
So I do want to. We're going to jump into some more things about that and the types of patients that would be ideal candidates. But before that, we do have to take another break here. So we'll be back after a few minutes. You're watching What's Up, Doc on Muslim Network TV. We'll be back in a brief few minutes.
My wife, she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it and spread the word, because the wisdom is there. So I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the U.S.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
Assalamu alaikum!
Open up your eyes.
Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppet stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe, and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
Adam's World. Believe me, there's a lot to see. Bismillah. Let's explore.
Hi, and welcome back to What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and today we are talking about all things acupuncture. Joining us is Alexandra Khouri. She is a licensed acupuncturist. And before the break, we were talking about some different techniques and different, diagnoses, that acupuncture may be ideal for. Something interesting that you mentioned, Alex, that I want to go back to is that you said you treat pregnant women. And I find that really interesting because there are not a lot of medications, right? When we talk about Western medicine, there are not a lot of medications that are safe for women who are pregnant or breastfeeding. We have different categories, A, B, C, X, and so D and X, and a lot of medications are B and C, which means that they're not, we don't know for sure that they're completely safe, right? Very little is in the A category, which means we know without a doubt that in human studies that it's also safe for pregnant women.
For the fetus,
yeah, exactly. And so tell me, I know it's hard to put acupuncture in that class, the same as medications, but it sounds like it's pretty safe.
Yes.
Would you say that? Okay.
There is a lot of acupuncture points that are contraindicated when somebody is pregnant. So we do not touch like the abdominal area. There are some points in the lower back that at certain trimesters, we can't touch either. Even points on the feet. There are some points that we really I tell my pregnant patients, really make sure when you get a massage, do not have them really put a lot of pressure on either like hand points. There's one point right here, that we kind of notice that it might create issues, or even some points on the bottom of their feet. So I do let the patient know what is safe. And there are some, contraindications, and even there are some other people that we don't really treat. For instance, people have seizure disorders. It's harder to treat them. Bleeding disorders, infectious skin disorders, or people with pacemakers. We really try to reduce or not use acupuncture. For some reason, there are some kind of side effects with that. But there are a lot of safe points. Other than that, we know the points. We study it. That's why we take board exams. We know what are the contraindications, and most of the exam is what are the contraindications. Literally, that's the exam.
Everything else is game as long as you avoid the contraindications, as you said. So with respect to some of these other things, you said people with pacemakers, seizures, etc. Are those absolute contraindications, or are they specific, or similar to the pregnant women, there are only specific points that are contraindicated?
I think, because acupuncture does help with like seizures, there's a lot of studies that have done, but you need to know which point. And for some reason, it's like seizures are also a kind of anomaly for a lot of doctors. It's kind of hard to figure out what happens with the needles. It somehow can trigger a seizure. So we kind of avoid that. It's because of the energy. Yeah. So if you're specialized in that, then you've studied a lot and you know how to treat that. In China, there are so many different categories, like people are separated into like treating, like a doctor would be, if they're like allergy meds, allergy specific or whatever it is, for me, I've usually treated a lot of pregnant women, so I know a lot about that and how to treat people who are pregnant or trying to get pregnant. Yeah.
Okay, excellent. And that's right. When we spoke in preparation for this, you mentioned that your particular specialty was in helping women with infertility issues.
Yeah.
Let's talk about that a little bit, because a lot of women are paying and doling out thousands and thousands of dollars for fertility treatment. And in this country, it's not a completely covered benefit for a lot of people, even with insurance, unfortunately, which is why it's a very expensive industry. So you're saying that with acupuncture, in some cases, all cases, let's talk a little bit about that and your experience with that and your patients.
I've seen a lot of patients for IVF, and in all age ranges, from like even in their early 20s to being a 40-year-old trying to get pregnant. So yes, acupuncture, what I do is we do a lot of a diagnosis in the beginning and trying to figure out, is their diet not really great? Are they eating really poor quality foods? Even in some cases, did the husband get tested? Sometimes it's the husband's fault,
More times than not, to be honest
Yeah.
with you. I always tell my patients, just get the husband tested first.
They have to.
Their testing is much easier than the one for women, right?
Yeah.
It's a very simple, straightforward thing for guys. It's literally a handful of tests, but for women, there's a barrage of tests that need to be done. And then you do the hard, it's like doing the harder job, and then come back and realizing that you could have figured this out with 3 tests. If you
Right. There was some, and you know, sometimes people don't know their cycle well enough. And I've had actually patients be like, you know what? I look at their cycle and I'm like, you're ovulating on day 10. Can you believe it? They think it's day 15. I'm like, no, you're really actually, it looks like you're ovulating with the temperature charts we do for the whole month or whatever it is. I'm like, you are really ovulating around day 10. I really think so. And then they get pregnant because they actually know when, you know,
when to try to conceive.
Try to conceive, exactly. Yeah. So there's a lot of that. And I've noticed also people who've taken a lot, I've noticed people taking a lot of birth control has actually created more issues after stopping birth control and trying to get pregnant. So I will say that's what I've noticed. And I say like the body needs to, they think like after they've stopped, they can get pregnant immediately. But
and
what
because I find this really interesting. I treat a lot of women, of course. Are you talking about all types? Because of course there's the injectable, there's a subcutaneous, there's oral. Are you talking about including oral?
I'm talking more about oral birth control because I don't know why IUDs and all these other ones that haven't had that much of a difference I've noticed. But for oral, I don't know what if it affects the hormones or not. But I say at least give it 3 months to detox from this medicine and clear it out of your body, because some of these women have taken it for 15 years, you know, or whatever it is. They've started when they're 15, either trying to get pregnant at 30. And we think in Chinese medicine, you need to like clear your body, make it like the energy full again.
Kind of recharging your battery.
And also see if that affected you in some way. And I wonder if that's the case. But that's what I've noticed. And a lot of times too, their diet is so poor. It's really poor quality foods, and you need a lot of people I've noticed who are vegetarian or vegan are having harder times to get pregnant. This is what I've seen and what I've treated. So I say like you need more protein. There's something going on. You have iron deficiency. There's like different things that I've noticed that we work with the doctors, or you know, they get tested or check their blood work. But again, the biggest thing that I think people have a reason why they're not getting pregnant is stress. They are type A women that have, when they give me their charts, I know I'm like, oh, you just need to relax.
You're like, I'm on a timeline. I should be pregnant by now. What's wrong?
Yeah. They know everything. They're like, I know when I know this. I'm like, you're just so stressed out. Your body shuts down. You know, you're having the fight or flight symptom all the time. Your kidneys are just working so hard. Your reproductive system is the last thing that your body needs. So it's just going to go. And I will say, like, your body doesn't need your reproductive system if you're on fight or flight mode every day. It just doesn't. So it's going to shut down.
Absolutely. And not outside of the realm of acupuncture, which I'm only learning more about tonight. In general, it's really funny that I have so many patients who similarly come in and they're like, oh, I can't get pregnant. And then as soon as they stop thinking about it, they're like, oh, we just get up, right? They're like, I'm done. If it happens, it happens. You know, months later, they come in for their first prenatal visit. I'm like, oh, you got pregnant. And they're like, yeah, we just stopped trying.
Right? They just stopped worrying about it.
Yeah, you're right. Stress. I mean, at the root cause of stress, it's, focusing on this one thing.
Yeah.
So that's great advice. I do want to, before we start to wrap up here, if you can share with us a lot of us suffer with stress, personally speaking, and just I see people on the daily who suffer from stress. Can you show us or share with us maybe a point or two that we can massage acupressure, really, not really self-administer acupuncture, but acupressure. Yeah, that we can maybe self-administer at home after a long day, or even in the middle of a long day to kind of get some relief.
So there's one really great point. It's right between your forehead, right here. Okay. And if you massage it in counterclockwise movement. Sorry. Yeah, clockwise. Sorry, not counterclockwise. Clockwise movement. I'm like looking at myself and saying,
I'm like, oh, am I giving myself more stress? Okay, so clockwise.
It's called yin tongue. It's like it's for everything. This is the one point that I do all the time for all my clients. Anytime they're coming in, it really somehow stimulates the brain, helps you just relax. A lot of times, if my children can't sleep, I usually massage this for my children. So this is one point. The other point is called large intestine 4. Now, if you're pregnant, this is one of the points I say don't really push it. But this is really great also for stress, for headaches. This is a great point. If you push down the right way, I don't know how to do this.
Pushing like here, right?
So if you go deep and you feel the edge where the bone meets, then you want to go slightly closer to the end. I'm like doing the worst job of explaining.
The fleshy part.
The fleshy part, and you actually push down, and you have to feel it. Like you really will feel some kind of tenderness there. I don't know if you're pushing it hard enough, but
I don't know if I am. Yeah. So
sometimes I use my thumb most of the time.
Okay. Yeah. I really have more strength in that. So you want to push till it's kind of tender.
A little bit tender, and you want to hold it at least like 5 to 10 seconds. Okay. And this is a great point also for stress, for constipation, it's for everything. It's a point that really helps, even a person feeling really upset or down. This is a really great point. And there's another point on the feet. There's so many points.
This is great. I mean, these two are like magic points. I think this one is like a magical point. It relieves everything.
It's a magical point. It is.
What about death? No, I'm kidding.
What? Oh, I know it will make you have thousands of dollars.
All right, I'm just kidding, obviously. But I know. Okay, so
this one is so important. This one, yin tongue, is like one of the biggest points that almost all acupuncturists use to help relax. And I know it's right between the eyes, so people are like, "What is that?" But it's the most important point of relaxation. Yeah.
Awesome.
And
go ahead.
And I don't know if you know the what is it called? The oh my God, I forgot the name. But there's a way of relaxing too. It's a tapping method, and they do acupuncture points to relax. So,
interesting. When I used to get facials pre-COVID, they would do that, and I was like, "What are they? Are they tapping?" I didn't realize it was part of their relaxation. I guess is what you're saying.
They're actually stimulating acupuncture points, so all over the face, which there's so many.
Very neat. So this has been a great episode. I've loved learning so much about this. For patients for people in our audience rather, who are interested in understanding insurance coverage, I don't know if you had to deal with that much. If you can just talk a little bit about insurance coverage, or are patients or people expected to pay out of pocket for something like this?
Yeah, so I mean, the cost of acupuncture session just depends on whether the practitioner is taking insurance or not. For example, I never took insurance, so most of the sessions, like the first session, would be around $120, which was around a 2-hour session, and then follow-up sessions can be between $60 to like $85 a session. So if you do have an acupuncturist that works with insurance, sometimes they have a copay for like $25 a session, and then they just submit the insurance, or sometimes the actual patient has to submit the insurance and pay in full, and then they would get reimbursed directly from the insurance companies. So it just depends on the practitioner if they take insurance or not.
Got it. Okay. Well, I mean, it does. I mean, $120 out of pocket for some patients. I know my patients
can be higher.
Sometimes you can pay like a $20 copay. So I wish, and I hope insurance companies listening.
Well, there are community acupuncture facilities, and then people are in a kind of like together, but they get treated, or they have like sheets that block them, but it's like around $25 to $35 a session. So there are it's called community acupuncture. So that it helps people who can't afford it get treatment. So there's a few facilities out there.
Okay, awesome. That's great to know, because I especially for someone who doesn't have any buy-in yet, for them to drop that amount of money on something that they're not sure is going to be helpful, even though we've gone over all the benefits, it would be great to have something like you said, a community acupuncture. You said community, is that what it's called? That they would look.
It's called community acupuncture, and there are places like it's usually in bigger cities. They have a lot of community acupuncture. Yeah.
Awesome. Well, thank you so much, Alex. This has been a great episode. We really appreciate you taking the time to go over this awesome topic, and then we wish you every success in your career.
Thank you so much.
Of course. Thank you for joining us on another episode of What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani. You can watch this episode and all our other episodes on our YouTube page at youtube.com/Muslim Network TV and on our website, muslimnetwork.tv. I will see you on another episode of What's Up, Doc.